Hello, my name is Andrew Burgee, and I'm the Hazardous Materials Training Coordinator for the NYU School of Global Public Health Hazardous Waste Worker Training Grant for our grantor, NIEHS. Welcome to our COVID-19 Exposure Recognition module. This module focuses on the use of personal protective equipment, or PPE. This is the most common control method, but often it may not be the most desirable. PPE protects many parts of the body, including your head, ears, eyes, lungs, and skin. It is important to know how to choose the appropriate PPE to offer appropriate protection to specific hazards. Lung protection can be provided with a respirator or mask. More information on respiratory PPE is available in our other offerings. Protective clothing includes eye and face shields, suits, aprons, gowns, gloves, and protective shoes. Please consider that this list is not exhaustive. Please also consider other hazard classes like chemical and physical hazards regarding appropriate barrier clothing. Each clothing type must be protective of the hazard in question, and training must be conducted to ensure proper use. When discussing the clothing PPE in this module, we will be assuming that a high level of exposure will be encountered in our target person's job duties. High exposure risk occupations are those working with people with known or suspected COVID-19, especially while performing aerosol or droplet generating procedures such as people working in hospital healthcare. When we think of infectious disease, we are trying to put a protective barrier between us and the pathogen in question, depending on the route of entry. Safety glasses can offer front and side protection from pathogens transmitted by sneezing or coughing or other exposures to respiratory droplets or aerosols. If more extensive protection is required, goggles can be used to further block out exposure, especially if the exposure is more aerosol in nature and can move under or over the front or around the sides of the safety glasses. Face shields in conjunction with safety glasses or goggles can further reduce the splash potential of gross pathogen contamination, such as a sneeze or biological splash of infected bodily fluids. They are disposable and reusable options. Protective suits such as Tyvek can protect the trunks, arms, and legs of a potentially exposed individual from gross contamination. They're disposable and reusable options. Additional protective body clothing like aprons and gowns can further protect the body from gross splash contamination, the same way a face shield further protects the face from splashes in conjunction with protective eyewear. The choice of an apron or gown depends on the type and magnitude of pathogen contamination. There are disposable and reusable options. Disposable and reusable gloves can also protect the hands from harmful exposures. The type of glove is dependent on the type of contamination, time length of exposure, quantity of exposure, dexterity required to do the job properly, and other considerations. Some commonly encountered gloves for pathogen control are nitrile and neoprene. Potent acids or bases may require butyl rubber, Viton, or another durable alternative. Regarding cost, Viton gloves generally can be more expensive than other gloves. Non-latex gloves, if applicable, are better because latex can trigger asthma and allergies. The 5 C's of gloves are as follows: cost, comfort, cleanliness, chemical compatibility, and construction. It is important to remove gloves in such a way to prevent or minimize contamination. Once gloves are removed, proper hand washing and hand sanitizing is important. Hands could either be washed or sanitized before and after glove use. More can be learned in our hand washing module. Finally, protective footwear selection is important, depending on the floor surfaces of the work environment, especially in a high-risk environment that is a healthcare or laboratory setting. Especially if the surfaces are prone to be slippery or the pathogen is too contagious to be tracked outside in a designated work environment. In the latter case of a healthcare setting, disposable booties may have to be used also. This is a mini quiz. Please answer the following 5 questions. Which type of PPE is being displayed in this picture? A Tyvek suit, protective apron, or protective gown? The most commonly used gloves in healthcare settings to safeguard against pathogens are nitrile, Viton, or latex. Which PPE would be more effective against aerosolized pathogens? Safety glasses or safety goggles? Which is not a 5C of glove selection? Cost, comfort, cleanliness, color, or construction? Which occupation would most likely wear the PPE shown in the accompanying photo? Healthcare setting or financial services back office? In conclusion, protective clothing includes eye and face shields, suits, aprons, gowns, gloves, and other protective shoes. Each clothing must be protective of the hazard in question, and training must be conducted to ensure proper use. That concludes module number 6. Be safe and thank you for your time.